Hi, everybody. Thank you. I want to take this off here. There we go. So, you've heard a lot today, and it's late. I see some eyes glazing over. I'll try to involve you more in this conversation. It makes things a little easier. But I think some resounding topics here that have been covered includes one size fits all is no good. There are lies in statistics to get somebody's point across. There's some flawed data out there. And what you thought you knew, you didn't. And that's why we're all here. That's why we're pushing medical freedom. Now, many of you know about what an endemic disease is. How many of your doctors told you to go get your flu shot? Now your COVID shot. Now RSV. I know many of you are old enough to remember when RSV was an infant disease. And you're wondering, why has it come out of the woodworks? Well, with the advent of these gene products that were untested that they thrust upon the population, they created something called immune dysregulation, and your immune system is altered as a result. So we're seeing respiratory syncytial virus disease as an endemic virus that used to have seasons. Now there are no seasons because it's affecting adults. I just want to make sure you know I have no conflicts. No one supports me financially to influence my opinions. That's something that's very rare, I'll just tell you that. So I'm just going to cover really lightly and quickly RSV, influenza, coronavirus, the endemic respiratory diseases that used to be seasonal, and now you hear about it all year round. It's no more the winter of death. By the way, I lived through 3 or 4 winters of death, and I'm not vaccinated. It's amazing. So what many of you might not know is this started out as an actual virus of a monkey, and it was a contaminant in the polio virus from Jonas Salk. It was introduced into humans, and it became an endemic disease because it was adapted into the human host. So I'm sure you've all heard other types of contaminants in the polio vaccine, like SV40 that caused cancer. And a lot of times when we try to fix something, we break a few other things. And that's when you have to really look at risk-benefit of taking on something like that. This is the RSV virus. It looks pretty. It looks like a thistle, right? It's not very pretty. It does a lot of nasty things. It has a viral envelope, bilipid layer. There's something called the F protein that is pathogenic, and that's a target of their vaccines. You saw Dr. Diamond discuss a little bit about how they made Crestor look like Superman, right? That used to be a rarity, that form of analysis in therapeutics. It was only reserved for the vaccine division of the FDA at the time. I see it now creeping into your therapeutics as well. I'm going to go over how that affects what you hear and what you think. So the reason why RSV is a problem in infants is it causes bronchiolitis. So because of their anatomy, it affects them differently. As you get older and you're more mature and you're more developed physiologically, it's tantamount to a cold. So when you see that commercial, I don't know, I saw it right before I got here, where there's all these party things and your family and you're hanging out, and all of a sudden it stops and there's this green flat line. You see that commercial? What kind of fear porn is that? It is literally insinuating that if you get RSV, you're a grown adult, you're going to die. But don't worry, they're coming to your rescue. Yes, they are. The RSV case fatality rate is less than 1%. Flu, COVID, even though they tell you otherwise, less than 1%. So I could go through all this, but it's a mild to moderate cold in adults. It does affect infants. 1% to 2% of infants are hospitalized with RSV, and 1% of that 1%, 2% may die. However, supportive care, hydration, that's what you use to treat an infant for RSV. And the problem was, it was a hospital cost. And they said, we need to come up with a solution to mitigate this cost. Well, their solutions cost more than the hospital hydration, I'll just tell you that. So current licensed RSV vaccines and monoclonals, you heard of Arexvy. What do they do this? Oh, God, I hate these DTC commercials. I really do. They need to stop. Abrysvo by Pfizer, Mrezvia, you see a little M before something? Run. That's all I'm going to tell you. Mrezvia and Beyfortus, which is actually a monoclonal antibody by Sanofi. The one-dose shot is believed to mount an immune response that may, got to use the word may, protect you in the future. I just want you to know that the definition of vaccines have changed. What you used to think prevented you from getting the disease, that is no longer the endpoint. They do not test for you not to get a disease. They do something now using an endpoint called symptom severity. Symptom severity is very subjective. It's not an objective thing. I remember reading the Pfizer EUA study for the COVID vaccine, and symptom severity could be you had a perceived fever. Not that it was recorded, but you think you had a fever, okay? That is what we're dealing with here, okay? So 34 deaths, 302 serious injuries from RSV vaccines in less than 1 year. That's just since the rollout. So again, we need to discuss a risk-benefit ratio analysis for every patient. Side effects, pain, redness, swelling when the shot's given, fatigue, fever, yada, yada, yada. You hear it all in every one of those commercials. 1 million side effects. Sounds like a party. Every time they start listing all the side effects, they're doing something fun to distract you. Woo, let's go kayaking while you get pulmonary embolism. Arexvy for adults 50 and over. It's recombinant RSF F protein targeted adjuvant system with liposomes and saponin, or saponin, how you want to call it. It's not designed or proven to prevent infection, only aimed at symptom severity. How's that perceived fever? Do y'all feel like you have a fever right now? Because that's important. Overall efficacy against lower respiratory disease, 82.6%. in a 12,000 patient cohort. So when you hear that, wow, it's 82.6% efficacious. I got to run out and get that. Okay, what does that mean? What does 86.2% efficacy mean? How's it derived? So 7 of the 12,466 patients injected with active vaccine showed symptoms of a lower respiratory tract infection. They say it's RSV. They can't test for it because the viral load is too low. So they're assuming it could be a cold, all right? But over 6.7 months, that's the duration they looked, 7 of those 12,466 patients had a lower respiratory infection. And 40 of 12,494 patients injected with placebo showed symptoms of lower respiratory tract infection over the same time period. Okay, so that sounds like it's significant. They use these big N's. I know Dr. Ameling was talking about you are an N of 1. This is an N of 12,466, and this is an N of 12,494. They make very large cohorts to try to say something, to try to show something. What that really meant was there was a 0.26% difference between the vaccinated and the placebo. Okay? 99.94% of the vaccinated did not show symptoms of a lower respiratory infection, and 99.68% of the placebo group didn't show symptoms. What does that really mean? Does that really mean 86.2% efficacy? Well, since they don't have enough patients to actually do the study because they don't have that enough sick people to do the study, they do something called, and you heard it earlier, relative risk. Relative risk is the big statistical rope-a-dope. It's not absolute risk, which is what you really want to know. The absolute risk here makes it look like, well, it's 0.26% different from placebo. So then you have to say, okay, I don't see a real benefit here. What are the risks? Because that's where these studies show. So you can see here, you had 2 times the risk in the vaccinated group than the placebo group. 4,880 adverse events were reported, and that is only over a short period of time. Where is the true benefit? They studied Arexvy during pregnancy. Well, because a significant number of infants died in the vaccine arm, they had to halt it. The big question was, the same type of targeted vaccine that Pfizer made, they approved for pregnancy. The only thing I can see different is maybe the adjuvant, but there's still serious concern here. Abrysvo, which is Pfizer's, same thing, RSV F protein vaccine. Instead of an adjuvant, they use other excipients. They like that. They like saying excipients. I had an argument with Dr. Paul Offit about what an excipient was. He thinks that prior vaccines, just testing the adjuvants as the placebo, is just excipients. If it has a biological activity in your body, it's not an excipient. So that's another lie they like to tell. So in their studies, they found out that potential risk of preterm birth, available data insufficient to establish or exclude a causal relationship between preterm birth and Abrysvo. They say it 2 different ways. I call it junk. Anyway, because they had insufficient data, they went ahead and approved it anyway. It's for adults 60 and over and pregnancy between 32 and 36 weeks. Remember when you shouldn't eat sushi, right? Remember when you should not have a glass of wine? You shouldn't do anything when you're pregnant, but it's okay now because the CDC tells you to get 4 vaccines while you're pregnant, and one of them is a gene product with no off switch. Think about that. So when you look at marketing materials like this, and doctors see it when the reps come in the office and detail them, wow, that looks pretty compelling. The blue line, that's placebo. And the orangish line, that's the vaccine. So you look at that and you say, wow, look at all the disease it prevented. That's what you think, until you see how the graph should look. They call this 62.1% efficacious for this injection. What does that mean? 22 of 17,215 patients showed symptoms of RSV over 7 months. 58 of 17,069 patients injected showed symptoms for placebo over 7 months. What is that? A 0.21% difference between the two. 0.21. Does that seem like something you want to run out and get? Understanding that oral therapeutics go through your metabolic system in your body, first pass through the liver, through the kidneys, you have a lot of things in place to detoxify yourself. But when it's something injected, it bypasses all of that. And rather than have more regulatory scrutiny for things that are injected and the components of them, we have less. They just push these things through like crazy. And that is a big problem. So when you look at it based on what they're doing, there's the red line, which is the RSV shot, and then there's the placebo. So it looks like, wow, There's so much benefit to that because you're not looking there on that axis to see what they're showing because it's marketing material. That's what it looks like when you utilize it according to the size of the cohort. That's what the RSV injection looks like for positive RSV cases and respiratory infection rate. And that is what placebo looks like. That doesn't look like the pictures in the marketing material. When you overlap them, they kind of look the same because statistically they are the same. That's relative risk. That's what we need to think about, right? So I'll just run through this really quickly. Mresvia is the mRNA version. I will stand by this till the day I die. Modified N1-methyl pseudouridated modified RNA platform should not go into any human, animal, or anyone regardless of age. Period. Zero, none, zero. They're trying to make it the platform of choice for all future vaccines. They're going to say old vaccines are bad and we need to do it this way. Say, no thank you, and walk out. Here, this is some red flags, right? They call this 69.9% efficacy. Do you know they only tracked the adverse events for 7 days? That is unheard of. You follow your patients in a study for the entire study duration and then post-marketing. They did it for 7 days. But what's even crazier about it is the amount of AEs in just those 7 days. Holy. So again, 69.9% efficacious means 0.38% difference between the placebo and the active arm. So what does that tell you? They only reported 7-day AEs, 12,119 AEs, and that's just in 7 days. These are gene products. You don't see the real damage that happens endlessly. Why? Because there's no off switch. There's no way to shut it off. Your body keeps making it. Your body recognizes it on your natural cells as something foreign. Your body attacks it. Autoimmune disease through the roof, among other things. You can't shut it off. Do you want this F protein produced in your body for the rest of your life? For the first time in human history, they talked everybody into thinking that your human body producing a foreign protein endlessly is a good thing. That blew my mind. These are just some of the side effects that are listed. Beyfortus is that monoclonal for the newborns. Guess what? It costs more than a supportive hospital stay. The very thing it was supposed to fix, it not only didn't fix, but there were 12 deaths in the treated group of the study against placebo, which had 4 deaths. That is a significant number of infants dying just from this monoclonal antibody. There's possible ADE, which is antibody-dependent enhancement. Your body goes crazy once it's primed. Everything is off kilter. That's where the immune dysregulation comes from. That's why adults are getting sick with RSV in the middle of the summer. That's why things are a little out of whack, okay? So according to VAERS, 27-day-old baby died immediately after getting a shot. An infant girl was found not breathing by her father 7 hours after getting Beyfortus. CDC recommends it to prevent RSV, did not disclose any of that. We're hoping with this new administration that changes. I'll skip through that really quickly. Influenza, wow. So mostly elderly patients, right? Men and women pretty equally. Don't you think that when you roll out something that is considered therapeutic, like a vaccine for influenza, that hospital and death should go down with vaccine uptake? The more vaccines, the lower the hospitalization and death? That is not the case. Yet we continue to chase strains. Last year's strain for this year's flu, These are some of the different efficacy, again, relative risk of what they call efficacious. What's left off is the current one. The current efficacy for the flu vaccine is a negative efficacy. You are 27% more likely to get the flu if you take the vaccine. That is a fact. 27% more likely to get the flu. So just think about that when hospitals mandate all healthcare workers to get a flu vaccine. They are more likely to infect you, they are transmissible for longer, and they don't end up with full immunity. This is over the course of mortality, influenza mortality, and vaccine coverage. Again, we're getting higher mortality and hospitalization with more vaccines. What is that telling you? We know that it suppresses your immune system. I can't tell you how many times I had someone tell me, you know, I never had the flu until I got the vaccine, then I got the flu. It immediately suppresses your immune system. It makes you susceptible to picking up pretty much anything. What is the point? When we keep chasing these strains, what ends up happening is we create more mutation. We force mutation, we keep it endemic. If we stopped it altogether for 10 years, watch what happens to the number of cases. Flu would be all but gone. So we know influenza, RSV, and of course the COVID vaccine, even with Cochrane studies and Mayo studies, 52 clinical trials assessing the effectiveness of influenza vaccines did not show a difference in hospitalizations. Why are we doing this? Who is involved? When we talk about one size fits all, that comes from the UN, that comes from the WHO, that comes from the WEF. They have infected our medical system like a cancer. That is where we are. Run away from anything that says One Health. You are one individual person, and that is what this country was based on. And I'm pretty sure that my colleagues can agree to this right here, because we've all felt this way since February of 2020, trying to warn people about the waterfall, and instead we get put in front of the medical boards, cursed out, told we were ignorant, the whole 9 yards. But like a true warrior, my friend Simone Gold there, we don't stop. Thank you.